Hello, Senator Okerlund, Representative Nielsen, and Congressman Chris Stewart. I wanted to address each of you today about the Utah statewide immunization information system and why this is such a benefit to the providers, healthcare providers, and the patients, and just the overall citizen of the state of Utah in so many ways. Mainly three ways to list in simple terms. This helps improve the ability and our ability to maintain records and keep correct records for our patients, for the providers of the vaccines and immunizations that we've administered to each one of our patients in the state. And this also helps to increase, by doing so, it dramatically improves our ability to increase the immunization rate and the vaccination rate of every individual within the state and all the patients that we take care of. And then last but not least, this saves the taxpayers a large amount of money, and the government a large amount of money of the cost of vaccines that we pay for each year for each individual. So about 1 in 5 U.S. children receives at least one unnecessary dose of vaccines by the age of 2, and this wastes about $15 million in vaccines. Not to mention exposes those patients of needless adverse effects of needless vaccines. And another thing too, this increases and improves the convenience of the provider and the patient to be able to retrieve their immunization records in one centralized location, regardless of the provider that they are going to. If they change providers and go to a different provider, or change schools and go to a different, if they change locations and they move to a new location, their immunization information stays in one centralized location, so that their new provider or whoever needs to retrieve the information can at a glance see what vaccines they received and what vaccines they need to receive. The cost to retrieve immunization information via a electronic database is 3 times cheaper than the cost that it takes to update and retrieve immunization records manually. There's 3 demographic age groups that are mainly involved, or mainly that we look at. The children in Utah have a higher rate of participation in the immunization information system, about 91.6%. And these are statistics from the CDC from 2013, so a couple of years old. However, they still drive the point home. And adolescence drops to 57.9%, and the adults in Utah drops to 49.7%. And the point that I wanted to make is that, and I think those numbers are quite generous, we're doing well with the children because there's a lot of incentive through the meaningful use for healthcare providers to push those immunizations among those children. However, this also puts us in line to become compliant with meaningful use for each of the providers in the state, and also to be online for Health Level 7, which is the interface with the CDC and the Centers for Medicare and Medicaid, with their database. By doing so, this puts us on the front line for this type of immunization technology, and to be able to link our databases and hopefully someday be able to cross borders even with this information. So the point I wanted to make, so with Utah children being at 91%, but the Utah adults being about 49%, there's a huge gap there that I think that we can solve with better support to the system, better advertising, and so we can inform the public of the service that it is, and so that they become more aware, and we can foster better participation with the system. One last thing I wanted to include in in this elevator speech as well is there's a new bill that is being presented. I believe it's in committee right now to expand the prescriptive authority of nurse practitioners in Utah, and I want to support this because this removes the constraint of the referral consultation rule that nurse practitioners currently have to prescribe the Schedule 2 and Schedule 3 medications. By removing that, this removes the constraint on each patient that nurse practitioners treat, and allows them to prescribe with full authority to those patients without having to go through a physician, which, like I said, constrains that healthcare, the delivery that they're able to give to each individual patient, and opens up and it allows better healthcare to better healthcare delivery, both financially and improves the autonomy of that nurse practitioner and the healthcare that they are able to give to those patients. So, anyways, this is my elevator speech, and I enjoyed giving it. I hope you enjoyed listening. Thank you.